recording.
Yep.
All right. So this is the second session of our healthcare enrollment for 2025. It starts on January 1st, 2025. Erin Pollock here is our broker and all around very knowledgeable individual about our healthcare. So I will give him the floor so that he can explain or answer questions that you have.
Awesome. Thanks. Um, okay, so for those of you who have been covered under the plan, a Nayamode plan for a while now, you'll notice that there are a couple of differences, and my intention is to go through some of those differences, but also to provide you with a little bit of background in terms of what has happened, what the general landscape is out there on the healthcare marketplace, kind of roll through the benefits. And I want to leave plenty of time for questions. So if you've got a question, please feel free to ask it, and we'll try to answer it as many as we possibly can. A lot of times you may come up with a question that's probably not appropriate for this format, especially being recorded. So if you have a question that is personal in nature and you don't want to ask it in front of this group, which is totally fine, just email Deidre or I or both of us, and we'll get to your question as quickly as we can so that we, don't leave you hanging. So again, it's pretty common to have a question after the fact, so please feel free to let us know what the questions are or concerns, and we'll get back to you pretty quickly because, as I'll go over in a minute, our timelines are pretty short. So now, having said that, what has happened, and this is not the first time this has happened with Nayamode. We have been contracting with a number of different carriers over the years, and what happens, typically speaking, is that the carrier or the trust that we're covered under will give us a renewal. We won't necessarily agree with the renewal, and so our options are to take a look out in the marketplace to see what else is available to us. And again, if you've been with us for a little while, you will notice that we are moving from the WTIA, the Washington Technology Industry Association, which was insured through United Healthcare, back to Regence Blue Shield. And we've been with Regence Blue Shield in the past. And as a matter of fact, for those of you who might have been covered under Regence through Nayamode, if you take a look at the benefit plans, you'll notice that they're very similar to what we have had in the past as well. The things that are not similar are, one, we've moved the effective date of the plans, the renewal and effective date of the plans, from December to January, which that came about because there was a lot of folks who had questions and concerns about coverage elsewhere, coverage with spouses. Everybody else's coverage seems to renew January 1st. Can we get this to coordinate with the resetting of our deductibles and out-of-pockets? And so we were able to move the plan effective date to January 1st. So rather than December 1st, as in the past, all of this stuff will take effect January 1st, coincident with the resetting of deductibles and all the rest of the stuff on the plans. So what precipitated us moving from United Healthcare to Regence was a pretty significant increase in the magnitude of just under 30%. Now, they give us lots of rationalizations for those rate increases, but after talking, with the folks at Nayamode, that was really unacceptable, because not only did that mean that Nayamode would have to pick up quite a bit of additional expenses, some of that would have to be passed along to the employees. So in order to try to minimize a lot of that and maintain, access to the provider networks and access to the dual options that we've got, when we went out to bid, we found the Regence plan, which still represented a slight increase in overall cost, but it did allow us to minimize those cost increases. And one thing you guys should know is that, the increase is being mostly more of the increase is being absorbed by Nayamode than it is by the employees. So the overall premium increased. Nayamode is picking up more of the cost increase than is being passed along to the employees in contributions. But you will notice that there is an increase in employee contributions. And when you do the comparison, I mean, obviously nobody likes an increase, but in the world of healthcare and health insurance, that seems to be the norm. We've seen this for the past, I can't even remember how many times we've done this. For the past 10 years, it seems to be that for the most part, we get a 10% increase or so every year. That's just kind of where we are, in the healthcare marketplace. So yes, there are increases. Nayamode is picking up a big chunk of those increases, but yes, there are increases to the contribution levels. So now is the time during our open enrollment period for you to take a look at the contribution increases and take a look at the benefit plans and see if you might want to switch between the benefit plans, because now is your opportunity to do that. After January 1st, your benefit plan elections are pretty much locked in for the balance of the year, unless you have what's called a qualifying event. So I would highly recommend doing the math, if you would, in terms of taking a look at what the employee contributions are, taking a look at what you might have spent or expect to spend this year in terms of medical care, and take a look at that and do the math. If you have the option to be covered under a spouse's plan potentially, I would also encourage you to do the math on that plan as well to see which one works out more favorably for you. And really, the tools that you've got to do that are the information that we've sent you email wise through the benefit summaries, and then there will be additional information on WorkBright if it's not there already. Is it out there yet?
It is not.
Okay. But the information you need, at least originally, to do that comparison and take a look at the benefit plans was emailed to you. And certainly, let us know if you didn't get it, if you can't find it, if you want us to send it to you again, just let us know. And as has happened in the past, we're under a little bit of a time crunch to get this information. We are changing carriers. The carrier needs updated information. And so we will be providing you with an enrollment form that is pretty easy to fill out. And then so we need you to fill out that enrollment form and get that back to us. We need to get this information into the carrier's hands by the middle of next week. So I know that, during this time period, like after Thanksgiving and like as you kind of move into Christmas, people don't really want to do a lot of work. So think of this as procrastination. So take 5 minutes, fill out the enrollment form. It's going to be on WorkBright, so just keep it out there on WorkBright. If you have questions, again, let us know. But we do need that information by the middle of next week, which is the 11th. So getting that to us will make sure that you get your ID cards and you get enrolled properly on the benefit plans. So that just makes the administration that much easier.
I
Okay, now
just want
so
to
far on
say,
that,
just real
before I
quick,
go
Aaron, I'm
into the
sorry.
different.
You said the 10th, you said the 11th. The due date is actually the 10th.
Okay, 10th. Okay,
It's
perfect.
one day.
It's even better
Yeah.
for me. So do any of you have questions about that from a functional standpoint or from an administrative standpoint before I get into the benefit plans? All right. Okay. So again, Nayamode has really attempted to make sure that the benefit plans that are being offered will kind of meet people where they are. So there are a couple of different benefit plans being offered. There continues to be an HSA qualified health plan that is being offered. For those of you who are currently covered under the HSA qualified health plan, you will notice that the deductible on this plan come January 1st is lower than the current plan. The current plan is $4,500. As we move into January 1st, the individual deductible on the HSA qualified plan is $3,500. So kind of a benefit there for you. Nayamode will continue to contribute towards the health savings account for those employees who elect the health savings account plan, $500 a year prorated monthly. So if you've been covered under Nayamode's plan and have had the HSA qualified plan for a while now, you probably have a fairly decent balance in your health savings account, which is exactly how it's designed to function. Perhaps you've drawn that down. Perhaps you make that choice every time you seek medical care, whether you want to use your HSA balance or whether you want to just pay out of pocket, satisfy the deductible. All of that is fine. So we continue to offer that health savings account plan. And in addition, we've got a more regular PPO plan that has a $2,000 annual deductible. That is the option for you to choose if you so decide. For those of you who are not familiar with the difference between those two plans, under an HSA qualified plan, everything, all expenses are subject to the deductible first before the carrier will start to share in the out-of-pocket expenses for you. So if you have a lot of prescription drugs, for example, you'll notice that under an HSA qualified plan, you've got to pay for those out of pocket first. Under the PPO plan, those are going to be mostly just subject to copays. And that's how you will that's the first line that people will notice, there's a difference between the PPO plan and the HSA qualified plan. But again, we've been covered under these types of plan designs for a while now, and they're very similar. Obviously, moving to Regents, you're going to get a new ID card. You're going to need to go to your physician, your pharmacist, and make sure that they have the updated information, because you're going to get new ID numbers, and they've got to know where to bill that. So that'd be part of the process, is to make sure that you share the updated information with all of your medical care providers. Does anybody have any questions on that?
No, but I have something to say about that. So when you, wow, I just lost my train of thought. When you go, United Healthcare did issue us new ID cards for the month of December, which is strange. So some people have experienced a little pushback when they try to renew their prescriptions this month or when they have a doctor's appointment.
Okay.
It's a little bit strange. They were a little bit late in realizing that we extended the healthcare plan to December, because as some of you who have been here with us before know that our plans used to stop as of November 1st and restart as of December 1st, but we extended it for January to January. They didn't record that, I guess, last year when we initiated it. So what they've done is they've issued new insurance cards for the month of December.
Okay.
And so the easiest thing to do would just be to log into United Healthcare, and you can download your information there, and it will only be valid for the month of December. So we apologize for that snafu, but that was on the behalf of United Healthcare. And so there is a new ID number. I don't believe our group number is different, but again, you want to log into your United Healthcare for this month. If you have any services that you need this month or any prescriptions that you need this month, you will need that new information. So just FYI.
Yeah, that's good to know. I wasn't sure if they were going to do that or not, but good to know. Good to let people know that there's probably more information that they need coming to them.
Yeah.
Okay, so moving on. So the medical plans insured by Regents For those of you who are either traveling outside of the state of Washington or who reside outside of the state of Washington, you can access any contracted Blue Cross or Blue Shield provider in the state in which you are either visiting or the state in which you live. We had a bunch of folks from the California plan on our prior call, and so this applies to them more than it does to a lot of the rest of the folks from Nayamode. But the way that that works, it's called Blue Card, and there's information on the back of your, will be information on the back of your Regent's Blue Shield ID card. And the way that it works, it's an internal mechanism for all of the Blue Cross and Blue Shield plans to coordinate. And what happens is that as long as you are seeing and receiving services from a contracted Blue Cross or Blue Shield provider, those services will be reimbursed as in-network expenses, not out-of-network expenses. So it really does work rather smoothly. What happens is that those providers are going to be contracted with a local Blue Cross or Blue Shield provider. We had this question come up from the California folks. The providers most likely are not going to be contracted with Regent's Blue Shield, but there are instructions on the back of the ID card, and they will contact the local Blue Cross or Blue Shield provider. They will submit the claims to the local Blue Cross or Blue Shield provider, and then internally between all of the Blue Cross Blue Shield plans, they coordinate, and Regents will pay the bill, and then kind of forward EOBs and all the rest of the stuff after that. So again, just make sure, if you want to have those expenses covered in network, that you're seeing, a contracted Blue Cross or Blue Shield provider out of the state. Inside of the state, you need to be going to a contracted Regents provider. Their information regarding their provider network is online. It's a little easier to use than it used to be in years past. And again, probably most of you haven't really changed your providers because we were covered under Regents before. So, but again, just make sure that you're seeing the appropriate provider if you want those reimbursed in network. You, of course, have the option to go outside of network anytime you want. The reimbursement levels are lower. So just pay attention to that. When you elect one of the medical plans, when you enroll in one of the medical plans, you will continue to receive dental and vision coverage as well as part of the overall package that is being offered. And it is offered as a package. You can't pick and choose between, oh, I don't want dental, or I do want dental, or I don't want vision. When you take the medical plan, you get dental and vision, and that's pretty much the way that it works. The dental plan continues to be insured by Delta Dental. You'll most likely get a new Delta Dental ID card as well. The vision plan is covered by Vision Service Plan, or VSP. They have VSP providers basically already have all of your information, and they can track you by Social Security number. If there are any questions, just let us know about VSP, but that kind of runs pretty easily. So it's a very similar plan structure. Medical plans through Regents, dental through Delta Dental, vision through VSP. We so far so good?
Kevin, did you have a question? I saw you start typing something, but.
Oh, I did type it. Then I thought, I could be more personal and just ask the question. I'll go ahead and I'll send it and I'll read it. So foreign travel, United Healthcare, I know covered because I checked between the plans when we joined, and what do we know about Regents? Is it most likely Canada, Mexico, but non-other European countries, so forth?
So everybody is covered basically for like emergency services and things that you might need while you're traveling anywhere in the world. So you have coverage anywhere in the world. The reality is that if you've traveled internationally and you've gone to a physician or a pharmacy outside of the US, they want your credit card. They don't really care about your insurance card. They're not going to bill the insurance carrier. They're going to charge it on your credit card. So what happens is that you're going to need to keep those receipts and submit them to, to Regents for reimbursement.
Okay.
Now, I mean, it could happen. There are relationships between the Blue Cross and Blue Shield organization and facilities worldwide. So on the back of the ID card, it's worth a shot to check to see, if there is somebody who's contracted directly with a Blue Cross or Blue Shield provider. But the most likely scenario is that you'll have to pay upfront and get reimbursed on the back end when you get back.
Very good. Okay. Thank you for that.
Sure.
I have a question. Is there any, I know a couple of the health insurance companies had gone through contract negotiations with some of the major hospitals. Do we, at one point, Regents was one of them, for Washington State, do we know if they tend to be accepted at the major, healthcare systems like, Evergreen and Overlake and
So the landscape, if you would, in terms of medical care and the contracting status between the carriers is always in flux. Anybody who has gone through this, and been covered under a health plan for a while has received those letters from a particular hospital chain or provider network to basically say, hey, we're no longer going to be contracting with X. And unfortunately, what happens is that every time, a provider contract is up between a carrier and a provider like Swedish, for example, rather than negotiating, the provider network actually just sends a letter to all of its members saying, hey, we're in negotiations and we're not going to be with Regents, we're not going to be with Primera Blue Cross as of January 1st. That's unfortunately the way that it has happened over the last 4 or 5 years. I would expect that over the course of the next year or so, some provider group is going to have an issue with one of the carriers. And that's pretty much what happens. Over the years, though, let's say the last 4 or 5 years, even though a lot of groups have threatened to leave the provider network, most of those networks have been pretty intact. So it's in everybody's best interest to make sure that those relationships remain. As of the current moment, there aren't any big threats out there within the Regents community of providers. There aren't any of the major systems that are not contracted with Regents. Primera still has a little bit of an issue with CHI Franciscans, and that kind of will go on for a while. But Regents's network has remained intact for quite a while, and I would expect that it's going to stay that way.
okay, well, thank you. Yeah, I know that it did get worked out. It's like they scare you,
Yes.
and then it works out. Yeah, thank you for that.
Yeah, and we're covered under just Regents's preferred provider network, so we're not covered under their Medicare or Medicaid networks and stuff like that. So basically, we're covered under their big preferred provider network. I just got in the chat, I don't know if you saw that, just received a letter that Virginia Mason is at risk with United Healthcare. Again, this is pretty common. I would expect that Virginia Mason will ultimately come to terms with United Healthcare. I mean, that's just the way that it's been. Again, I expect that's going to happen continually over the next couple of years. Right now, we're pretty solid though. And if something does happen, the reality is you'll get a letter probably before we even know about it, which is kind of embarrassing, but that's just the way that it works. They send letters to their members first, and then they send it to the carrier saying, hey, we're not going to be in your network. That's pretty much what happens.
Do we know what the network name is for Regents?
It should just be their preferred provider network. I don't think Regions has.
It seems to be
Yeah.
a case sensitive type.
Oh,
It wouldn't necessarily expect anybody to have it here, but you know, one of the first things, so it's nice to do is like understand whether, because you don't want to switch doctors. So it's like, how are the dice going to roll?
yeah.
Right.
Are we still covered, or is it, or we just know that we're just going to pay a little more?
Yeah.
So I tried to
I s-
enter like the name based on the PDFs, but I'll have to play around a little more to find one that it likes.
I can see where he's talking about. I just went to the website that he is on, and it does not provide like a drop down or anything like that. You actually have to type in a network name. So I
Yeah.
think that's what he's asking. Do we
Oh,
have
okay.
that?
Oh, I guess there is a browse a list of networks, and maybe I could do a match that way. But you know, some plans there's like when I
Specific.
was joining Nayamode, I was looking at various things, and
Yeah.
I think Regents is one that has a pretty broad list, but maybe you can narrow it down.
Yeah. So,
Employer-sponsored plans,
Oh yeah.
it's not
Medical
Medicare, not
Advantage
dental,
PPO network.
not Blue Card, not individual, be either employer-sponsored, like maybe preferred network, employer-sponsored.
yeah,
I'm
we'll
like,
do
I'm
some
gonna
we'll do
roll with
some
that.
research there and try to confirm the easiest way to find it.
I think that works.
One of the other ways to confirm that is to actually call your physician.
Sure.
Don't talk to your doctor
Well,
because your doctor probably doesn't know, but the front desk will know,
they
and
will,
they'll know who they're contracted with. And so just as a, just to confirm, say, hey, we're going to be covered under Regents under employer sponsored plan come January 1st. Just wanted to make sure that you're covered, that you're contracted with them.
But
they,
if we don't
for-
know our network name, they may not know either.
right. There'd be like multiple Regents plans that there's some are in, some are out. It's kind of like that with Delta Dental, which there's like more than one plan.
There are, yeah.
And
So
yeah,
when you get, so a lot of these doc find features online are easier to use once you've received your ID card.
for sure.
Because once you've gotten your ID card, then you plug in, your group number and your member ID number, and it will take you to the network that you are covered under. So they have done that. And I would also encourage folks to go out to Regents and create an online profile because that's available to you. And once you go online and create an account at regents.com, there's all kinds of other things that you can do. You can track, your expenses during the course of the year without having to request an explanation of benefits. If you lose your ID card, you can get a new ID card online. You can actually get like a temporary ID card online as well. So I encourage folks to actually go out, create an account, and it's some of the stuff there is easier than trying to work through their customer service department.
Question for you, Aaron, though. In
Mhm.
light of people trying to make the decision on if they're going to take advantage of the employer-sponsored plan, is there a way that you can confirm what
Yeah,
our
I'll go out
network
there and we'll
is
try to figure.
before
We'll
signing
confirm
on?
what it is.
Okay.
Yeah, and then we'll let everybody know when you get the email from us saying, "Oh, by the way, where's your information?"
Right.
Yeah,
Okay.
and as far as like creating an account, do we need to wait for them to have our information so that they would be able to identify us as a customer?
That is
So
correct.
the form needs to be, see, okay.
Yep, that is correct.
I mean, I guess I knew the answer. I just talked that silly question out loud.
It's all right.
Sometimes it happens like that. You got to say it out loud for it to, for it to click
Of
sometimes.
course, yeah.
So, and Deirdre, just, we're just expecting any day that it will be in WorkBright so that we could, fill it out.
My intention was to have it out there already, but it is WorkBright who is the bottleneck here. I am still waiting for them to upload the sheet so that it is available to you guys. I gave it to them last week. So I'm going to be pinging them today to make sure that it's available today. At
Okay.
least by tomorrow. It should be available today, but I don't want to make promises because I don't know where they are in that process. But I will do my best to get it up there for you today.
Thank you
Sometime
so
this
much.
afternoon. Yeah, yeah, no worries.
I know it's out of your control, but out of your control, and yet it's your responsibility.
It's all right. It happens that way sometimes.
Yeah, a good
Gotta
friend
roll
of
with the
mine,
punches.
his rule in life is don't worry about things you can't control. But in this situation, it's like I can't control that, but I'm worried about it.
Yeah.
Right? It's good advice, but hard to follow.
Oh, what's this? Regions Blue Shield Washington
I think
Preferred Network.
I think that might be it. We'll see. I guess we'll see soon, but
Well, yeah.
just
That
trying
kind
to
of
narrow it down.
coincides with what Aaron just stated. Preferred network, right, Aaron?
Yeah.
Should be.
I didn't
But we're
see
not
the
going to confirm that as of right now until he gets back to us.
right.
Yep.
Yeah. And I
Give him
didn't
a
see
chance
the
to look it
HMO.
up and make sure.
Great. Good.
Perfect. Does anybody have any more questions for us? Nobody? No one?
No, I don't think I've been to a doctor in 2 years either. Which it's
Keeping my
probably
fingers crossed
like,
for you. Yeah.
it's like I was thinking about that a day ago. It's like, okay, well, I should probably just creep in and get caught
At
up on
least
things.
once a year, Kevin.
I know. Well, I used to go all the time, but because I would go to the doctor's office on campus, Microsoft, and then after I left, it's like I haven't been
It was
to
convenient
talk.
for you.
It was
That's what
super
happened.
convenient. And now, the whole go find somebody new thing is not
Yeah.
not a lot of fun. So
There's a lot of
anyways,
apps out there that will help you find good doctors. You can look at reviews and stuff. So that's good.
I will have to do that. My family's, they've moved on with new medical practitioners.
You're the
I've
last of the
just been,
Mohicans on this one.
yeah. I guess I've been fortunate to,
Well, even if you've been fortunate, you're when you go see a provider, they're still probably going to shake their head and tisk you for not showing
I
up on a
know.
more regular
Yeah.
basis.
Yeah.
Got the moral high ground.
I know. I think this should be more than just emergency coverage when we pay as much as we do. So
Part of that's a gender thing. Guys in general
I know
don't.
as they say that, yeah, it could be, probably is. Yeah.
And y'all be the ones statistically that leave the earth before we do. I'm gonna need you guys to get to the doctor, please.
Yeah.
We do want you healthy, indeed.
Yes.
Indeed. Okay. Well, I'll take this opportunity to look at the Regions Network.
Okay.
So, thank
Awesome.
you.
All right. And again, if you guys have questions after the fact, just let us know and we'll get back to you as soon as we can.
Thanks for putting this session together.
No problem. This is recorded, so I will put it on our Nayamode YouTube. That's private. Only people with, the link will be able to access it, but I'll send that out to the studio as soon as this session is done. Well, sooner. Maybe not immediate.
So quick question, do we just keep going on to WorkBright to see if the documents are there, or are you gonna send out a communication?
I'll probably send out a communication. Thank you for that. That's a good idea. I will send out a notification as soon as my harassment of their processes is complete and they get it uploaded for us. So I'll try and, yeah, I'll send out a notification.
Cool. Otherwise, I'm just going on there checking every once in a while anyway, so.
I might text you directly. I'd be like, hey, it's ready. But I'll send it to everyone.
Yeah.
So,
Cool.
all right. Well, thank you for attending, Miss Diane.
Thanks for having the meeting. It's always good to catch up and see faces, even though you don't see my face. You just see a tile.
It's fine. It's fine. All right, I'm going to end the recording now. As soon as I can figure out how to do that. Okay, stop recording. Perfect.